Hello, my name is Debbie Smith. I'm a nursing student at St. Petersburg College, and this is my community analysis presentation on the city of South Pasadena, Florida. I will start with the historical overview of the community of South Pasadena, Florida. 1942 is the earliest recording of South Pasadena that I obtained from the clerk's office. At that time, it consisted of 25 residents, 8 buildings, and 1 main street known as Pasadena Way. In 1955, on July the 1st, during a town hall meeting, South Pasadena was incorporated. The community has evolved over time. From 1942 to 2016, the population has increased from 25 residents to approximately 6,000. The city has evolved into a retirement community with the average age of 69. There are several nursing homes and ALFs and retirement centers in the city. The city also has several banks, restaurants, grocery stores, and church buildings. The city has its own mayor's office, fire departments, and parks. It has its own hospital that serves the citizens of South Pasadena and the surrounding cities. The next slide will address the structure of the community. How does this community compare structurally in meeting the needs of the community members compared to other similar and surrounding communities? The structure of South Pasadena, Florida is as most cities in that it has a mayor's office, fire department, churches, grocery stores, nursing homes, a hospital, parks, a gas station, and I compared it to St. Petersburg, so they share their tropical climate and they both are surrounded by water. South Pasadena was compared to the city of St. Petersburg. They both have a mayor's office. St. Petersburg has schools. Pasadena depends on St. Petersburg for their schools. They have fire departments. South Pasadena depends on St. Petersburg for colleges. They have grocery stores, but they have more grocery stores. South Pasadena depends on St. Petersburg for the health department, and South Pasadena also depends on St. Petersburg for their larger hospitals, and it is where they go to pay their utilities. And they also depend on St. Petersburg for city transportation. Continuing on with the structure of the community and the issues they may face. One of the issues is the speed limit on their one major roadway. Another issue is the limited cultural diversity, as evident by the population is 97% Caucasian. And another issue would be flooding and evacuation during a disaster. In analysis of the population of the community, the issues I found are a lack of cultural diversity, as evident by the population is approximately 97% Caucasian. The average age of 69, which shows an aging population. Where is the youth? And the average age of 69 makes the community not inviting for young people that want to start families and raise a family. Continuing with the analysis of the population of the community. Comparisons of health concerns in the community to what the literature states are issues. South Pasadena health concerns are aging population, access to adequate nutrition, lack of care to promote independence, decline in their mobility, inadequate transportation, and lack of access to emergent help. The literature states that the issues among the aging population are falls resulting in serious injuries, the critically injured, the chronically ill, increase in mortality rates, diabetes, and heart disease. And this literature came from C. Devarney from an article titled Network in Florida Harnesses Data to Improve Care Quality for an Aging Population. Analysis of adequacy of health-related resources and availability. What is the availability of resources? And we like to incorporate with that access, acceptability, and affordability. Within the city limits, they have access to CVS Pharmacy, 3 major grocery stores with pharmacies, nursing homes with skilled nursing and rehabilitation services, a hospital in the community, and they have access to elder hotline for community resources. All these services accept Medicare, Medicaid, supplemental insurance, most private insurance, and private pay, and this makes it affordable. Adequacy of health-related resources and availability continues. Using Healthy People 2020, I selected 3 specific community objectives, and they are more data monitoring systems. If we had more database monitoring systems, this would help to identify the elderly population with disabilities. Once we could identify them, then we would like to monitor their medication use. The purpose for monitoring the medication use is to decrease inappropriate medication use among the elderly and disabled. And with the database monitoring systems, we could monitor their medical appointments. And the purpose for this is to decrease the delay in primary and preventive care. Analysis of the environment. What is adequacy of environmental resources in the community? I will justify my views as I go along. Within this community, there's 3 major grocery stores with pharmacies. The grocery store is the closest source for food and nutrition and a place where they can obtain their medications. This community has 5 extended care facilities. Once unable to care for themselves, they can go to a facility in their own community. This community also has 4 large parks and 4 mini parks, so they have adequate safe parks to walk or ride their bikes in their own community. Their housing is adequate. They have a local hospital, so if anything happens to them, they have access to the community hospital within minutes. They have their own dentist, optometrist, fire department, and there's a professional building there where they could go and see a private doctor. Analysis of the environment continues. Summary of issues pertinent to the community related to environment concerns are daily care that will help residents stay in their homes, the speed of cars on the 1 major roadway to the beaches, and sewage disposal during a hurricane. Analysis of government and public policy. We will discuss the economic and political functioning of the community. The 5 city commissioners are accessible via phone numbers and email addresses that appear on the city website. Poor attendance to the town hall meetings due to the residents' decreased mobility, lack of transportation, and the scheduled hours of the meetings. South Pasadena portrays a balanced budget annually with funds set aside if disaster comes to the city. Analysis of government and public policy continues. Areas of economic, political, or public policy concerns are the citizens who like to see the speed limit decrease on the major roads. Due to the small land mass, there is no room to expand the neighborhood roads. The crime rate is low, there are no signs of homeless people, and low-income housing is available for the elderly. I took a look at the overall community needs and prioritized them. They need access to nutritious meals to help them maintain their health. They need access to assistance in the home to maintain their independence. If they can stay in their home, they will thrive better, and this will decrease their exposure to institutionalized infections. Their caregiver needs to have a relief person to help them because without it they're exhausted. They need access to transportation. If they're already disabled, then they cannot get around to get the things that they need. They need help to prepare for hurricanes. If they're already disabled, then they don't have the capability of getting out to get the things that they need to prepare for a hurricane. So they need help in that area. And they also need help for evacuation during a disaster. Pinellas County Medical Emergency need more manpower to help the elderly during a disaster. South Pasadena, Florida does suffer from a global issue, which is flooding. The World Health Organization and Europe sent help to Bosnia, Croatia, and Serbia in 2014 with cross-country help to flooded areas. They sent emergency health kits with medicines and other supplies. They sent funds. They sent water and purification equipment. They gave public health advice to the affected areas. And they also stayed around after the aftermath and assessed for damages. Now we comparing that to what we do here in Pinellas County for our South Pasadena residents. We are taught to prepare early, do not buy or build in a flood zone, buy flood insurance when living in a flood zone, know in advance about your safe house, shelters, and pet shelters. Prepare early for the elderly and the disabled. Have water and non-perishable foods to last through the aftermath. And also create a temporary bathroom facility. Global community issues continue. Discuss how a community health nurse would intervene to address the issue. As a community health nurse, I would propose partnering with Pinellas County Emergency Preparedness Team. Make use of the South Pasadena Town Hall and have an annual disaster preparedness meeting. Update the community on the location of local and new shelters, safe houses, and pet shelters. Give out resources to flood insurance and evacuation zones. Educate on what is considered non-perishable food items and first aid. This ends our presentation on the community of South Pasadena, Florida.